Welcome everyone to the Virtual Compassion Action Healthcare Conference. I'm Beth Lown, Chief Medical Officer at the Schwartz Center for Compassionate Healthcare. On behalf of all of us at the Schwartz Center, we're so happy that you've joined us for today's Story Hour and presentation, StoryCorps and the Power of Listening. Before we begin, I want to remind everyone to share your chat messages and your questions for our panelists with everyone, so that we can try to build some connection and community in this virtual space. And now please welcome our presenters for this session. Joining us today are Emily Jansen, the Associate Director of Learning Engagement at StoryCorps, and Perry Chinole, the Managing Director of Learning and Engagement at StoryCorps. And for those of you who are unfamiliar with StoryCorps, it is a national nonprofit. It's a national oral history project whose mission is to preserve and share humanity's stories in order to build connections between people and create a more just and compassionate world. I love StoryCorps. I never miss it. I listen to it every single Friday morning on my public radio station. So Emily, Perry, thank you both so much for joining us. I'll turn it over to you.
Thank you, Beth. I am so excited to be here. We're all really excited to be connected to the Schwartz Center and to have this time to get to spend with all of you. Before we really dive in, we always like to just kind of get grounded and get a sense of who we are and who we're here with. So throughout this time today, I'll be walking us through listening to some stories. And Perry, who you may have seen wave, she is going to be with you in the chat this whole time. So let's kind of start that now. And we would just love to hear from you in the chat and share with us and with each other sort of who are you and where are you joining us from today? And that can even just be physically. And if you want a little bonus question, you can tell us something that brought you joy today. So I'll just say mine out loud. I'm Emily and I'm from StoryCorps. StoryCorps is in Brooklyn, but I'm actually joining you from Jersey City in my apartment. So that's where I am. And today the sun is shining and it is bringing me immense joy today. So if you can all, for those of you who like to do it, if you'd like, just kind of use the chat and say hello to Perry, say hello to each other, and just let us know. Let us know what's happening. So while we're doing that, while we're getting to know each other a little bit, just wanted to do a little bit of housekeeping. What are we going to do here together today? I'm just going to introduce you really briefly to StoryCorps and our mission, and share more about StoryCorps' Legacy program and its impact on participants and partners. But we're going to spend most of our time together listening to stories from healthcare professionals that are in our archive. Some of these stories were recorded this year in the past 11 months. So we're going to hear them talking about their experiences during the COVID-19 pandemic. And we're going to let you know when we get to that section, in case for those of you who want to stay and listen to that, and for some who want a little bit of a break from that, can take a little break. And so we invite you today to be with us and participate in any way that feels right and comfortable for you. So maybe you're a little Zoom fatigued and you want to turn your screen off and just listen, sit back, close your eyes and listen with us today. We welcome you to do that if that's the best way to use your time. If you're feeling like engaging more, there's a lot of wonderful people here to build community with. And so we really invite you to use that chat space to talk with each other. Perry's going to be in there who can reflect with you. And, you can react as we go along and listen to stories and kind of share your reactions with each other. We're also going to save some time for questions at the end. So we invite you also to share your questions in the Q&A box. So on the bottom of your screen, you can go there and ask your questions. And we might not get to all of them later, but we'll really do our best. So I'm just taking a quick look so that I can see that we have so many people coming from all the way spreading across the whole country. And so It's really wonderful to see you all, and so happy to be here with you in community. So let's get started. StoryCorps, for those of you who don't know, StoryCorps is a project that was founded 15 years ago by a radio documentarian named Dave Isay. And Dave just had a really brilliant, simple idea, which was that everyone should be able to record their story and that all of those stories should be preserved for posterity in the American Folklife Center at the Library of Congress. In 2003, we started in Grand Central Terminal in New York City. You can see that here, this hustling and bustling transportation center tucked away in the corner. We built a small soundproof recording booth. And since then, that really simple idea that Dave has taken off. So to date, over 500,000 people have shared their stories with StoryCorps. People come to the recordings in pairs, usually in one of the soundproof booths, like the one that you see here. This is the one that was in Grand Central Terminal. They sit together face to face and talk to one another about the things that have been most memorable and meaningful for them in their lives. And most importantly, they sit and they listen to one another. A facilitator is there to record the conversation and to ask follow-up questions, but for the most part, it's just two people talking to and listening to one another. Every day our archive grows, and as it does, it really encompasses the diversity of this country and its people. It is now the largest collection of human voices gathered in one place. And so through this archive, we're really building an extraordinary tapestry of everyday lives, and these stories paint a picture of who we really are in our own words. We like to think of StoryCorps conversations as poems about who we are as people. So what we do at StoryCorps is we make these recordings and we archive them, but we also share them with the world so that we can listen and learn from them. So we have a weekly broadcast segment on National Public Radio. You may have heard it on Friday mornings. Each week during the StoryCorps broadcast, you'll hear a short excerpt from one of those longer 40-minute conversations in our archive. You're not hearing a journalist telling you what to think, just two people talking about their lives. So I'd like to share with you one of those stories now. Kristen Solers and Marcy Eberts are nurses at St. Luke's Hospital in Kansas City, Missouri. They worked side by side in the intensive care unit for years and grew so close that they've come to call themselves work wives. So let's listen.
Don't you feel like you're a nurse everywhere you go? I mean, let's be honest. Every time we get on a plane, you're like, E6 didn't look good to me.
Yeah,
Keep
keep
an eye up there.
Between us, we've taken care of thousands of critically ill patients.
Yeah. When I think about that patient that is the most seared in my brain, I know exactly what bed they were in, but I cannot tell you the patient's name. I always think about CCU bed 2. That guy with his wife,
yeah.
remember that? Cardiac arrest on the stairs to bed. And we code him and we get that heart rate back.
And that was just the first of a dozen times that he coded.
Yeah. We were giving her the bad prognosis. Things were looking really bad. And she said, "Can I be in bed with him?" This man's got everything we've got in the hospital attached to him.
So many wires and tubes and monitors.
From the head and the foot and the left and the right. And we go in and we lift all those things that are attached to him. And we wiggle her from the foot of the bed to lying next to him. And I can just remember her sobbing, saying, "I wasn't a good enough wife. I should have loved you better."
I remember when there he goes into VFib again. And we had to start compressions again. And then she said, "Stop. We're going to let him go next time he does that."
To be with people and to create those environments where they get to say their unfinished business to their husband. It's such a gift of a job. Sometimes I wonder why everyone in the world doesn't want to be a nurse.
All your patients, you carry a little bit of them with you, and they shape you.
It does impact the way we see the entire world. That person in front of us in the grocery store is all worked up about how that guy bagged their groceries.
I mean, what do you mean you can't take this coupon?
Yeah, this isn't worth getting so worked up about.
Nobody's dying.
Yeah.
Until someone is. And then we're ready.
And then we're ready.
Okay, Melissa's just telling me that the volume maybe was a little quiet for some of you, so we'll try to fix that for the next one. So even in this short few minutes, which are part of that longer 40-minute conversation that Marcy and Kristen shared, even in those few minutes, you can hear a little bit of the key ingredients to what makes a StoryCorps conversation special. The first is a sacred space, as we sometimes call it, that a safe and comfortable space that's really met with intention of time and place. The second is that a StoryCorps conversation is that it's conversational. So instead of being a journalist or a historian or a clinician interviewing you, it's two people who know each other and care about each other and are having that intimate conversation. And then finally, it's participant-led. The experience at the center of a StoryCorps conversation is always that of the participants. So while we share questions to help them prepare and think about ways they might want to have those conversations, it's always their 40 minutes to talk about what matters to them. After they have the conversation, they decide if they want to share it with StoryCorps and the Library of Congress, or if they prefer to keep it as a private legacy just for themselves and their families. So over the past 5 years, we've conducted surveys, as organizations do, with our community partners and participants of StoryCorps interviews and members of the general public who listen to our stories. And we've seen overwhelmingly that both participating in those conversations and listening to them fuels connection, increases empathy, and builds engagement. So our participants say they feel more connected to their interview partner. They feel that they understand them better. They start to think about their own experiences as more meaningful. And it also prompts them to become more involved in the space they've recorded. So when we've had partnerships that invite people to participate, 66% of those participants say they plan to become more involved with that organization that brought them to StoryCorps. And I just want to share this final one. Didn't even list it up here, but especially as we're entering Thanksgiving season, one more thing that we found from participants and listeners is that they leave those stories inspired to share gratitude with someone in their lives who they care about. And I just really love that. You might be feeling that right now too. And I hope that you might leave here and think about the people who matter to you and really say to them, thank you, I love you, and you matter. So with all of this knowledge of what we've known and we've witnessed about what these conversations can mean for people, 10 years ago, StoryCorps launched a program called StoryCorps Legacy. And that was to provide people living with serious illness, as well as their families and their caregivers, the opportunity to record conversations together. So building on what we had witnessed and on the legacy of so many researchers and professionals who found that deep and meaningful connection between the worlds of storytelling and medicine, we began to make that opportunity more readily available and accessible. So in this photo, you'll see Desna and Kevin. These are StoryCorps Legacy's very first participants. They recorded their interview in their apartment in the Bronx on a cold day in January 2010. And that's where this photo is taken. If some of you have your screens off, you'll just see Desna sitting in an armchair covered in plastic, kind of kitty corner from Kevin, who's holding a binder with his questions. And you can see they're in their home with lots of family photos on the wall and tchotchkes on the shelves, and Desna's wheelchair sitting in the corner. In their conversation, Desna passed along words of wisdom to Kevin and talked about how her faith was really sustaining her as she approached the end of her life. Kevin sang his mother's favorite gospel song, which brought tears to her eyes. A few weeks later, Desna died, and the recording was used at her memorial service. So StoryCorps Legacy has grown and developed so much since its humble beginnings in Desna's apartment, but their interview really remains the core of what Legacy is all about. In our Legacy program, we train healthcare teams across the country to play the role of StoryCorps facilitators. Those teams use professional quality recording equipment to record interviews wherever their patients and families are most comfortable. You can see some of them here. They're regularly set up in hospital rooms, in people's homes, Now with the ongoing pandemic, we've really trained our partners to use online virtual recording platform that StoryCorps developed so they can continue to provide this opportunity remotely and combat isolation for their patients. And so you see a lot of these spaces here in these photos, but we also invite professional caregivers and healthcare staff to participate and share their own experiences and insights from their work. And so those are some of the stories we're going to listen to together today. At its heart, StoryCorps Legacy is about providing people at that critical juncture in their life who so often feel a need to be heard, with a space to share their stories, to tell loved ones how they feel about them, and to know that their experiences will live on in their recordings. And I think no one can really say it better than those who have experienced it. And so here, one of our former partners, Hospice Austin, Nancy McCraney there says, something happens in the telling of our stories that is powerful and sometimes even healing. To ask someone about their life is to realize that we share so much in common, that we belong to each other in deep, mysterious ways, that we're part of one another. As one of our patients said after his StoryCorps experience, I don't feel like I'm dying, I feel like I'm living. I feel like I'm finally waking up. Since we began, we have partnered in the past 10 years with over 60 healthcare organizations, and they have recorded almost 3,000 interviews through the Legacy program. So these are some of the stories that we're going to share. First, we hear from Cecily Chambers. She's on the right there. She's an interfaith chaplain who has provided spiritual support to seniors and hospice patients suffering from dementia. She speaks with her son, William, who was 9 at the time of this recording. Just trying to make sure that we sound good here.
What went through your mind when I said, do you want to come to work with me and visit with some seniors?
My original thought was, oh no.
You'd rather stay home and play video games?
Well, I was a little afraid. Then when I got there, I really liked it.
Why did you like it so much?
I liked it because they were very thoughtful. They were very accepting.
I remember the first day I took you, we sat at this long table and I was helping feed a resident who couldn't feed herself. And you sat at the end of the table with another resident who just started talking to you, and you just jumped into her world. You didn't try to correct her. She had a baby doll, and she thought the baby doll was real. You didn't say, oh no, that's just a doll. You just went with her.
I think people are free to think whatever they want to think. They don't need to believe in what other people believe in. What have you learned from the residents?
I think I learned about the importance of being present and the beauty of just little small moments.
They made me think you should enjoy life as much as you can, because it doesn't happen forever. Do you think it was hard to say goodbye to them every day when you know they may die sometime soon?
It was hard. There's no doubt about it. Every time I left there, I knew that there was a chance that one of them wouldn't be there when I got back the next week. Do you think that your experience coming to work with me will affect you in the future?
I really do.
You can say no.
I think before, I wouldn't think as much about the world and how hard it can be. And I wouldn't be the same person.
Do you like the person you are today because of that?
I really do.
Yeah, I think that's really
I
important.
like the person that they've helped me become.
So now we're gonna hear from another healthcare worker, Trent Garrison. He is part of the patient transport team at the hospital where he works. And this story was recorded by StoryCorps Legacy partner Stanford Health and edited by Carolina Correa for them. And bear with me, we're just gonna hop over to their site to take a listen to this conversation.
I transport patients throughout the hospital from point A to point B, and I believe is really important because without us, how is a patient going to get their scans in a timely manner to tell either good news or bad news to their loved ones at home that are anxiously waiting, what's going on with my mom, what's going on with my aunt? So I go in to each situation open-minded, caring, understanding that they might not want to be here. They don't feel good. They're worried, their loved ones are in and out when they can. I always ask an icebreaker question like, where are you from? So if they could tell me they're from Oregon and they love to fish, or if they're from Hawaii and they love the beach, then I know that their mind is not on what's really going on. And it takes me back to when I was a patient here. 6 months after I was hired on, I got sick with diverticulitis. I had a pretty big surgery, and it's frustrating that you're not home. You're not feeling good. You're out of your element. And to understand how a patient feels, like myself at that time, really opened my eyes to understand how these patients feel today. So for me to go in there and make them feel good again, that's just what I like to do. And it turns. You run into them later on in life, and they remember each and every thing we've talked about. And I actually had an experience that was eye-opening. We're school shopping at Walmart, and, I'm looking at pencils and trying to find the coolest backpack for my kids. And family member comes up to me, and he goes, "You're Trent, right?" I was like, "Yeah." He's all, "You helped my mom in Stanford Hospital. I want to thank you for that. She's not around, but you guys definitely left a mark on our family." And the feeling that I got and I get today from that story it's just a great feeling. And I think that's what life's about, is just being happy and doing what you do. Just knowing that we woke up this morning to help somebody that's not feeling well, like, I'm blessed. And it's just a great feeling to walk into these doors every day.
So you can hear more from that collection. Perry can share a link with you, and we'll have some follow-up resources to share as well, with some additional collections from some of our StoryCorps Legacy partners, OHSU, Providence St. Joseph. They all have really beautiful and large collections of stories that they've recorded in their systems. Just wanted to share this. Isan Koyama is a chaplain. You can see him right here, who trained as a facilitator for a StoryCorps partnership. And he shared this about his experience creating space for conversations with patients and families. Seeing people be nourished by this project also makes us feel nourished. I really felt a resurgence of my original inspiration to do this job. So this is a good place for us to take a little pause and just kind of check in with all of you. We'd love to hear again more about who you are. What role do you play at your institution? I'm sure there might be nurses, doctors, social workers, anyone in that whole system of care. We're curious who is with us today. And also would love to hear, what's the role of narrative in your work right now? So just prompting that question for you, and love to hear from you. Kind of give you that space while we take in those stories and just take a breath and let ourselves think about take in those conversations. I know that with our partners, have really integrated StoryCorps conversations into their already existing legacy making programs and hospice programs, have really done that through some of their chaplains, and have just been in a lot of different departments really supporting people. Let's see, we'll give you all a little chance to say that, and I'm going to start to queue up our next set of stories. This is great. We're hearing from folks who do community engagement, who are really looking at helping individuals become engaged with their own health, providing one-on-one support and listening to others' narratives. I love this. Thank you all so much. Thanks, Julie and Judy and Leslie and Stephanie. For those of you who aren't in the chat, there's some great things there. This is great. We have people doing complex case management. Yeah, thank you all so much. So I'm going to keep us moving. I want you to continue a conversation there. We love hearing what you're doing and love hearing your reactions as we share these stories as well. These in a lot of ways are our gift of gratitude to you, a thanks for all of the work that you do. Really now in this past year and throughout your whole careers. So now is the point that what we're going to do, we're going to take some time to really share stories recorded in the midst of the pandemic. So up until now, everything we've shared, you can probably tell by the nature of those conversations and what they're describing, really talking about moments that happened before this. But now we're going to hear from professionals on the front lines who are talking with their family members in most of these cases. And so if you want to stay with us, we'll just be for about 10 or 15 minutes. Or if you want to walk away and take a little break, take a breath, you can do that too, and just come back and join us for our final time together. So we really learned at StoryCorps, as you saw, StoryCorps is about being really connected physically and taking these times that we don't usually take to actually sit down face to face and be close with one another. So when the pandemic hit and it meant that we needed to be physically separated from family and friends and neighbors and community, we worked very quickly to develop a platform so that people could continue to come together and record and preserve their stories. So using video conferencing technology, our virtual platform and StoryCorps Connect allows you to see each other, to approximate that feeling of being face-to-face, to record a conversation and archive the audio of that conversation with StoryCorps. So we're going to take a little journey. We're just going to hear a few stories. We have many more that we'll share with you that you can listen to later when you have time. But we're going to go back to April of this year. Dan Flynn, you can see him on the left here. He has a passion for helping people. As a funeral director in Santa Barbara, California, he has supported many families during times of loss, but in response to COVID-19, he was compelled to help in a different kind of way. He spoke at StoryCorps with his daughter, Shannon, about why he chose to serve at the epicenter of the pandemic at the time as a member of the National Mortuary Response Team in New York City. So we're going to listen to them talk with each other now.
When you got called to New York, were you scared?
Any responder will tell you that it's part of our makeup that when everybody's running away from the danger, we run towards it. It's just part of the fiber of my being, I guess, to go to where there's this kind of a need.
All you ever see is the stuff on the news. And you calling me up and telling me you're going to New York, I was terrified. Knowing your personality made that 10 times worse because I knew if somebody dropped on the street having symptoms, you would be the first person to pick them up and run them to the hospital despite the fact that you could catch COVID also. But I was also proud because you are that person. How did New Yorkers respond to you guys being there?
On our first day, people pulled their cars over and got out of their cars and they started applauding. People on bicycles and people on the sidewalk would shout, "Thank you." And as long as I live, I'll never forget this sight. As we were walking right in the middle of an intersection, a disabled veteran stood up out of his wheelchair and he saluted as we walked by. It was incredibly moving. And that sight will never leave me.
It's your attitude toward helping people that made me want to work with patients who have brain tumors. And I would rather run into the fire with my cancer patients instead of just taking the easy way. And that is your doing, because you always were there to tell me, don't do it the easy way, do it the right way.
I think of you as this warrior and living up to your middle name, Valerie, for valor. I hope you remember that you are smarter than you think and you're stronger than you feel.
I'm very proud to be your daughter.
I will always love you, darling.
So now let's move ahead a little bit. In May, we sat down with the director of microbiology at a hospital in Rochester, New York, Dr. Roberto Vargas. You can see him here. As he had a conversation with his wife, Susan, and Xavier, one of his 4 children. He had been working really long hours in the lab running COVID-19 tests, and because of the risk of exposure, he was isolating himself from Susan and their kids. At first, he stayed in a hotel near the hospital, and then he moved into the basement of their home. So you'll hear them talking with each other, actually connected via this virtual platform because they were quarantining. And you'll actually first, you won't hear any sound while you read the introduction, and then it'll come in.
When I would go to the hotel room after a long day and it was just me there and it was very quiet, that was when I missed you all the most.
It got very worrying once I knew the virus was going to be like a big thing. And with you gone, it was way harder. I just missed you.
I remember he'd drop groceries off and put them on the front porch. And that's when we started talking through the window next to our front door. You would talk on your cell phone and the kids and I would sit behind the window. And I remember one of the hardest nights, I think you were just exhausted. You just had your head on the window and were crying. But eventually you started sleeping in the basement. And I would not let the kids go past the top of the basement stairs.
We had to stay far away. But I just felt better that you could be like a part of us.
Mm-hmm.
It's still very hard, but it's nice to see you, Dad.
You have been so helpful to Mom. So thank you, okay?
Thanks.
I remember once you came into the basement, the best night I had yet, you know, your coworker had made all these different dishes for us. You sat at the bottom of the stairs in a rocking chair, and I was at the top.
I remember that, yes. I even remember the food. It smelled so good.
It was the first time we had been able to connect in so long. And as crazy as it sounds, it's the best date I've ever had with you in my life.
Without you, I wouldn't have been able to do what I've been able to do at work. You have to be absolutely everything to our 4 beautiful kids. I've never loved you more, and I know it hasn't been easy.
Could you guys try not to cry? It makes me sad when you cry.
Oh, sorry, honey. These are tears of happiness. Roberto, I admire you so much. Always admired you, but you've done things these past couple months that seem impossible.
What you're doing is a lot harder than what I'm doing. A lot harder.
Dad, I just want to say thank you for helping get rid of this virus.
That's a team effort, and that team includes you. But what carries me through is this family.
finally, this fall, mother and daughter social workers Michelle Dawn Houston and Lauren Magana came together to talk about their shared calling, helping people in the last stages of their lives. They first recorded actually a StoryCorps interview in Atlanta back in 2018, and you're going to hear a tiny bit of that conversation first. And then they returned this year to talk about how their jobs have changed since the lockdown caused by the virus.
My grandmother was dying, and I went to see her, and she was barely speaking, but said to me, "Be happy." So I took that and literally changed my life 180 degrees. I went back home, told your dad that I needed a divorce, and I had dropped out of high school at the age of 17, and I went to college. At 40 years old, I started undergrad program, and now I work with the dying. So that's how it started.
I always tell people when they ask me, why did you become a social worker? I tell them, well, my mom was kicking butt all the way through school, and you humanized people, and you taught me how not to be afraid of people because people have value. It is a privilege to be a part of, even a small part of their life, and then a privilege to help them move on to wherever is beyond death. And you've really inspired me to do that.
It has been tragic in ways that, unless you are in this business, would be hard to understand. I've lost several people over these last couple months that I wasn't able to say goodbye to. And so that has been really hard.
Yeah, I called you the other day crying because you're one of the few people that I know that truly understand like how hard our job is. I went to help this man who's well in his 90s. I'm in like a gown and I have 2 masks on, and I am trying to talk to him, and he can't hear. He's hard of hearing. And he started just openly weeping, sobbing. And then he shakily stands up and he grabs me and hugs me and says into my ear, "I can't hug my granddaughter, so I'm going to hug you." And I started to lose it, and we weren't supposed to touch, but it was so worth it.
Well, this has definitely been a challenging few months, but I just want you to know that I am extremely proud of you, and it is such a privilege to be in this work with you.
I think that I am really, really blessed to be able to know what I want to do and do it and love it and do it with my mom.
I really hope that these stories have served as a little bit of a thank you to all of you and a celebration of the work that you do. Perry and I and everyone at StoryCorps are so honored to be able to hold space so that conversations like this can happen, and they can be preserved for your families. They can be preserved for generations to come, and we can really shed light on our lives together by listening to them. So we do invite you, especially we're in this Thanksgiving season. I know that for Perry and I, these past 11 months have really brought a sense of wanting to connect with those that we love the most. And so we encourage you to use some of StoryCorps' free tools to record your conversation with someone that you love in your life. Thanksgiving time is a traditional time at StoryCorps to do that, but really encourage you. We have the StoryCorps app which you can download to your smartphone. That's when you can be with the people that you love in a space with them. But if you want to connect from a distance, the way those last few stories did, we have what's called StoryCorps Connect, and you can use that. So wherever you are this holiday season, if your loved ones are far away and you want to have this type of conversation, I encourage you to do that, or even just to have that conversation and not record it, and take that time together. So that's my invitation to you. But before we break for Q&A, we love our moments of reflection, and we've just been listening to people talking about really lifting each other up. And so our reflection question for today is, what's one thing that someone in your community has done to support you in the recent months? Kind of take this moment to have a little moment of gratitude as we come into the November Thanksgiving season. So encourage you to be in the chat and share those stories or share those moments, or even if it's just a person or something that you're grateful for. It gives us a little bit of an opportunity for that. And we also have so many more stories to share. I think the Schwartz Center is going to, we have some resources we're going to share at the end, so that you can really dig in and listen to even more stories of your colleagues across so many professions who touch people's lives in the spaces that you do. So this is great. Ellen's saying that their building has come together to support each other with little surprises. People providing meal support. It's beautiful. I love this. Stephanie is saying their son has decided that a daily hug during the pandemic is what will help us get through this period. That's really beautiful. So if you want to think about that now, or you just want to reflect on that on your own, you can always add into the chat more. I am going to bring, Perry's been sitting with you in the chat, but I'm going to bring her up so that we can have the opportunity to answer some questions if you have them. So if you haven't already and you have questions for us about StoryCorps, about what we do in StoryCorps Legacy, sort of the door is open to any type of question that you want to ask. Perry and I are here for you. You can also see if you want to get in touch with us in the future. If now's not the time you really want to dig in, you can reach out to Perry and I via email. We're really always happy to hear from you. Perry, I see a question already coming from Heather. How does an organization become a partner? Do you want to take it?
Sure. So thanks for that question. It's a great one. Our partner organizations are incredible, and we work with more than 500 organizations every year. So there are a few ways that we partner with organizations. The first is to share with them some of the free resources and tools that we have, and a little guidance through our help center, so that they can kind of create programs on their own. We also do partnerships where we actually will either send our staff to record conversations on site or now virtually. And we have partnerships where we actually train staff to do StoryCorps interviews at their location. It all depends on what the goals of the organizations are, if they have budget. I think that one of the very unique things about StoryCorps is that we provide a lot of free resources. And, so it can be as kind of low touch partnership to high touch partnership. And it really depends on what the goals of the organizations are. But, Legacy is an incredible program with a whole bunch of things that we can share with you. So the simple answer to your question is that organizations get in touch with us and we kind of figure out what makes the most sense.
Anyone, does anyone else have any questions? Even those, I know you Schwartz Center insiders, you can ask us questions too. I know this is also a time, it is the middle of the day. It has been a week, it has been a month, it has been a year. So, so there's no need to raise your hand and be present in class. You can just kind of let the stories ride over you and let someone else ask the question and reach out to us when you're really feeling the energy.
I also think that, you know, as we're thinking about some of the questions, it might be helpful to just tell you about 2 tools that we have as we go into Thanksgiving next year. There is a tool called the StoryCorps app, which allows people to record on their smartphones. And that's something that you could use even beginning today with a loved one that you are at home with or in person with. That is a platform that will allow you to record and then archive if you want, like publish for archiving at the Library of Congress. And the second tool that we have is something called StoryCorps Connect, which would allow you to record remotely with somebody who you can't be with right now. So it's a little bit like a Zoom. It's like a recorded Zoom call, but the audio gets, if you'd like, can also get archived and join the StoryCorps archive and the archive at the Library of Congress. Emily put the links to both of those in the chat. And you know, I think that just heading into what I think will be kind of a tough holiday for a lot of us, these might be some ways that you know, that we can at least try to connect with one another.
Do you see, Perry, we have a really great question from Peggy. What is the process for becoming a facilitator?
Oh, that's really great. That's a great question. So we are hiring facilitators always on a rolling basis. The best way is really to check out, you know, our website and see when they come up. But basically, a lot of our terms for facilitators are on an annual or, you know, a 2-year kind of 2-year time period. And that's just because the work is really intensive. You're listening to hundreds and hundreds of stories. And yeah, we would just say, you know, check that out, apply, be in touch. But yeah, we've had incredible people who really have, you know, really have like love the honor of being able to bear witness, similar to the work that you all do.
But in addition, I do want to say that one of the really beautiful parts of an organization or institution being a StoryCorps Legacy partner is that we train, part of that partnership is to train a cohort of facilitators where you are. So our staff come and give you a really deep, intensive training at those skills of being a StoryCorps facilitator, so that that group where you are can do that work in your hospice, in your hospital, in your program where you are. And you're getting those skills from StoryCorps staff. We're sort of passing that along to you so that you can really take that to the next level.
Yeah. And I would also add that one of the story that we had played from Stanford was recorded in that way, right? So we had trained staff at Stanford and actually at a couple of different hospitals where folks are here, and then they've gone throughout the hospital to record StoryCorps interviews on equipment that we've provided.
Perry, I do want to pick up a question from the chat. Sort of Judy and Lynn are asking about using the StoryCorps app, using StoryCorps Connect. When you do that, you are given the opportunity to share your recording into the StoryCorps archive, into this virtual cloud. And you can do that. When you do it, you'll choose privacy settings. So if you want to be the only one who can view it, if you want to share it with our StoryCorps archive users, or if the whole world can see it. But that's an easy way then to share that with your family and friends. You can send them a link to that conversation. And I would say it's a really great tool for you to think about personally if you want to use this, and as a resource you can share with patients and families. And you can use any of the resources when you're on the links to the pages we have. We have some even downloadable documents that just kind of walk them through the step-by-step, here's what it looks like, here's how it is, and would really encourage you to be offering that as another way that they can engage personally and individually with their families. Trying to.
And then we see a question, a really great question about the idea of healthcare workers engaging in conversations with patients. I would say that of the 60 partnerships that we've done through Legacy and the many more that we've done through other programs at StoryCorps, we have seen all sorts of configurations around the pairing of the participants. So usually it's two people who know each other. And again, this can be family, it can be patient staff, which is incredible. It can be staff and staff. And I think that there's something to be learned in this model of conversation that is always something new. So, even if their patient really well, there are aspects of that person's life that I think really kind of create bonds. And when we have trained facilitators to sit in on conversations, even if they are not the ones doing the interview, they're learning new things about their patients that we imagine can only help to improve their care. And so, we have seen that in many anecdotal ways in the past. And yes, absolutely, that, giving space to talk about some of these experiences collectively has on the whole, been really, really beneficial. So thanks for that question. I mean, I think that, there's something very special to the intentional model of sitting down together, with microphones and really carving out the space for this type of connection.
Perry, we want to bring you one last story before we have to say goodbye, which we don't want to say goodbye. I know there's a couple other quick questions that came through in the chat and the Q&A, but before we listen to the last story, I just want to say again, thank you so much for spending this time with us, for taking time out. I know you're all incredibly busy. We're all a little bit zoomed out. So I appreciate you really giving us that gift of your time. That is very precious, we know. So this final story that we're going to listen to will end where we hear from a mother and a hospital worker. So Ellen Hughes is on the right. When her son Walker tried a new medication, it was supposed to help calm him down, but it wound up doing the opposite. He's 33 years old. He became agitated and violent. He has autism and struggled to communicate what was going on, but his mom, Ellen, knew that they had to get to a hospital. And when they arrived at Loyola University Medical Center near Chicago, Walker bit Ellen. And that's when they encountered Public Safety Sergeant Keith Miller. You can see him on the left here. At StoryCorps, Ellen told Keith how he helped her son and herself get the care that they needed that day.
We're driving at rush hour, and my sweet guy is screaming and grabbing me, and we're just scared to death. This is not the guy I know at all. We were already anticipating what was going to happen in this emergency room, because when he was a little boy, an officer got on his back while he was screaming. And he's been handcuffed to gurneys in emergency rooms just for having a seizure and being big. That day, we show up at a hospital. Here's this giant 6'3" guy just bit his old mom. Yeah. I'm sitting there brokenhearted, scared out of my mind, bleeding. Yeah. And Walker's trying to run away. And I see like 5 guys on him. And all I can think is, this will not end well. They're going to kill him. But suddenly I hear this cute game
All right.
Where he's trying to escape, and you're going, Walker gets up. Walker sits down. Walker scoots back. Walker lies down. And then you said high fives all around. And I thought, he won't do it. And I look and he's beaming and he's high fiving every single officer. And then you started singing. And I thought I would lose it forever.
I started singing Mr. Rogers' Neighborhood.
You're singing Mr. Rogers with these men. And he went from being terrified to feeling like he had cool friends, cool guys hanging out with him.
Yeah. I saw this man who was dealing with something he just did not understand.
Yes.
And I saw the fear in your face. It touched me personally. My son is 14. He was 15 months when he was first diagnosed as being autistic. Being a father of a child who has autism, I don't know what changes is going to occur in him. And as parents, we're there to help them deal with their obstacles. And if we can't do it by ourselves, there's other people out there to help. And I want to be one of those other people.
Well, nobody else does what you do. We look like a very scary situation coming in there. And we turned into a kind of party I think people wanted to join. I've been in a lot of ERs, and some people have been kind of nice. I never sat there and felt like this is one of the most important moments of my life.
I want to thank you both, Emily and Perry. I always just cry uncontrollably during StoryCorps. Today is no different. So I try to control myself, but it's just been an amazing hour. And I so appreciate what you do. It so resonates with what we believe and what we try to do. And Schwartz Rounds, just like your work, is completely based on storytelling. And it's through those acts of empathy that we feel more connected with each other. And we get restored to this sort of sense of calling. So thank you. I know I have to attend to business, Melissa, but I want to thank our business members as well. We really wouldn't be having this conference if not for them. So thank you to them. And for those of you who want continuing ed credit, just keep a lookout for the link that we send as usual. And you know, our conference is coming to a close. Tomorrow is the final session. And I think it's going to be interesting. It's the title is We Are in This Together, Key Lessons Revealed in Critical Choices Ahead. And it's going to be moderated by the Boston Bureau Chief of the New York Times, Ellen Brand, in conversation with Dr. Donald Berwick, who many of you know is President Emeritus Senior Fellow at the Institute for Healthcare Improvement, and me. So we're going to have a conversation about what we've learned and what positive lessons we might be able to take to refashion our healthcare system in a more compassionate way. So thank you to our StoryCorps friends. Thank you all for joining us, and we'll see you tomorrow.